Buongiorno, buongiorno a tutti e
Good morning. Good morning, everyone, and welcome to this digital event by the EMDR Association. Welcome. It's a real pleasure to have you here in this moment. The day is very complex and also very challenging. I'll shortly introduce myself. I'm a new face in these meetings. I'm Federico Luperi, Director of Innovation New Media in ADN Kronos. I work on scientific dissemination every day, and today I'll be the moderator of the different moments throughout the day. I will try to be like the leitmotif between all the people that are going to take part and tell you about these past 10 months of intervention, EMDR and the pandemic, a really challenging year, a year that has been unprecedented and that we will try to summarize today in a general overview to understand what we have done. But today's event is also special for one more reason. In this moment, we are followed by colleagues from all over Europe, different international associations are connected with us on a twin channel, twin to the one you are following here from Italy, of course. There's the translation, simultaneous translations into English. So I want to greet also the people who are from outside of Italy and who are now following us in this description of the activity of EMDR Italy. 2020 is about to come to its end. Many might say, luckily, we are at the end of it. This has really been a very complex year, greatly impacting an experience we could never think of. Great impact also in psychological terms. The pandemics in general, the fear, the lockdown, the limitations, we are all bound to the last ones, those that were released yesterday evening for the next Christmas holidays. An epidemiological situation which is still quite worrying, as a matter of fact. This is the first limited, bounded Christmas of our history. Anxiety, depression, and particularly continuous worrying concerning news. A never-ending worry. Today, thanks to the person of EMDR Italy, we'll try to get into the details of these things and what solutions we have implemented that have worked, thus understanding which behaviors we have to take up. The day is quite long. We have also included some moments of break. However, we'll be together for many hours until around 5 this afternoon. So, without losing any more time, let's start work. And of course, we are starting with Isabel Fernandez, the chair of EMDR Italy. And so, Isabel, how's living with the pandemic? This has really marked, actually, all of us. Morning, Mrs. Fernandez. Morning, everyone, and thank you for taking part in this event. Well, as Luperi was saying, living together has been the great challenge because this emergency has been on for 10 months and actually it is going to last, unfortunately, for long, because we have no possibility to foresee when it is going to come to an end. What we actually had to do in terms of adaptation, particularly from the point of view of our cognitive adaptation, because we've always tried to provide a meaning to what was happening. Well, this was the great challenge, the greatest challenge for us, particularly understanding the information the opinions that have always been different. Everyone was saying the own word. We have tried to find the information that could better and best actually represent reality. This was greatly stressing, and from the cognitive point of view, it was very, very tough to actually go through it. We need to understand what's happening so that we can answer appropriately. We have never had any certainties. We have discovered different situations day after day, week after week. That was something that, of course, we had never experienced before. So it was really very stressing for everyone, and it is still very stressing. This is like that for our functioning too. So a hypertrophic flow of news, the difficulty to find orientation, being suspended while waiting for the latest regulations, a situation of constant uncertainty, like as if the earth below us is not safe and sound. This has put all of us to test, psychologically speaking, and this working situation too has really become quite precarious for many of us. But even though you could continue with your working activity through technological methods, well, everyone had to tackle technical difficulties and the stress coming from longer working hours, because the technological device did not allow us to really stop at one time. What were the most impressive moments, also in general terms, not only from a psychological point of view? What's going to remain within our own memory? Well, for sure, we will always have the memory of isolation, limitations, the fact of not being free to make projects, to carry out our daily, normal, ordinary life. As we've often seen, this has reactivated previous experiences from childhood, adolescence, other periods in our lives when very, very heavy situations were experienced. So one of the things we are witnessing more is this reactivation of emotions, sensations, feelings, thoughts that had somehow already been experienced before. However, I was mostly impressed as regards our association by the naturalness which we could have in responding to this emergency during its evolution. We have adapted all our experiences we had gained before during other emergencies, and we have adapted it timely. We were able to respond to several calls for help. We have seen that several institutions actually called us, and this has been a great feedback, not only from clients, but from the institutions too that asked the EMDR Association to work with them and to provide support. Hence, municipalities, hospitals, we are going to see many examples throughout this day. Also, the health sanitary system, schools, ministries. It is very important to understand how our association has now become a reference point at institutional level too. We have had 550 colleagues who have taken part in this activity in the past 10 months. And in my opinion, this has been really impressive. 250 interventions in the first and in the second pandemic wave. And I believe that they are always available also for the forthcoming months when new requests come up, new challenges come up, and new situations evolve. So your words are quite impressive for me too, Mrs. Fernandez, also as regards your long-standing collaboration with the institutions. Of course, I've always had that as a journalist. The moment was so special, so peculiar, that the institutions had the ability to react even in a new way, thus opening up to interventions and to requesting, calling for support, which is not so common in our previous history. However, Mrs. Fernandez, you were talking about 550 colleagues involved, a number of interventions supporting institutions like local administrations, hospitals, and regions. During this day, we are having several speakers talking to you to share witness of what we have done. I really want to thank Mrs. Fernandez now, and I would actually head towards the first moment of in-depth analysis with Mrs. Stefania Sacchezzin, who's going to introduce the first part of the analysis throughout the day. We are going to also have slides, videos, and in-depth analysis. As I said before, the event is also translated into English for European colleagues, and we are on a direct video stream too. Throughout the whole day, I will actually tell you what are the moments we are going to start working with and when we are having breaks, because of course we must all have breaks throughout the day. So, Mrs. Sacchezzin, let's try to understand what are the global general trends, in your opinion, that we can summarize after a period like this. Mrs. Sacchezzin, good morning, everyone. Thanks, Federico. Thanks, Isabel. For sure, this is a very long period, and the fact of having so many faces one after the other, that so many victims from the pandemics, all of us. It is interesting to think that during all these phases, people have discovered somehow the possible new modalities to tackle a thing like this, a crisis like this. We've dealt with many different realities, particularly with the association. Since the beginning, we've been present in the territories hit by the first wave, Crema, Bergamo area, Mantua area. The situation was exploding at the time, and there was a prevalence of absurdity and unbelievable feeling in that period, but that seemed to have a limited period of impact. Then we saw it was not like that. We had to tackle a very complex situation also from the point of view of the managing the emergency. This emergency is an emergency in which rescuers were deprived of their own certainties and self-protection. And we must think about them not only as rescuers, but as people, particularly, who are involved directly. Over 200 doctors died due to the COVID pandemic. Many nurses, too, health operators were strongly impacted by this situation. But talking about them, we are talking about the population, because we know that the reaction chain falls as a cascade onto all the population. So let's imagine all this terror and anguish that then penetrated their families, and also the places devoted to rescuing people. Those were the places where in the first wave we had no control over infections. And the second phase, after summer, no one of us actually could think during summer that we had left the pandemic behind us. We had to restart after some. We were tired, demotivated, as you, Federico, were saying, precarious work always in our mind, and a number of implications that brought to increased irritability, discomfort, and mood effects. So we are tackling a very delicate issue that is going to be with us for months to come. This is why the association, I and all the colleagues want to make all the community colleagues and patients feel like they can exchange what they are experiencing, even in a very quick way, because we know this is a protection factor for the human being. Receiving comfort and soothing and protection, it means we can start and process our own injuries. What I'm impacted by is it seems we are experiencing like a low battery situation. We cannot get recharged, and since we cannot do that, we find it harder and harder to tackle the new situation because everything seems more complex. From the point of view of your direct work, how could you relate onto the territories where you had to work with the people who were fighting against the pandemics? At the beginning, if we think about last spring, we even lacked knowledge about what was happening. You talked about the Bergamo area, the Valseriana area. I visited those areas to tell about what was happening. The hospitals there were really infectious and infection spots. So how was it for you to talk to the people who were committed in helping us? Well, they were totally overwhelmed by the strength and the violence of the virus. Considering a maxi emergency, it is important to consider the whole context. The emergency was little by little, however, very quickly within a few days, passed from hospital management to territorial management. Larger facilities like ATS were involved. They actually work on treatments at home for people in need, involving all the people who are in contact with the population. They had very large numbers to manage and very few possibilities to actually channel them into a hospital support. Working with them was getting immediately on the same line. Where we were in Bergamo with Isabel, I think we immediately activated our empathy, the empathy that you engage for survival, because the institutions very simply opened their doors to us. And within the institutions, we could find many colleagues who were at the top of different units, as you will see in the video witnesses. They were within ATS and hospitals, also local area health units that generated the partnership out of this need. It was a very intense work, also in terms of human relationships. This allowed the very same health workers to trust us within very short. We'll see figures from the Bergamo area. The health workers, we could actually treat those particularly who were quarantined because they were COVID-infected people at home. They had to stay at home. That moment was quite difficult for them because they had to demobilize, but they always had in mind all the violent situations they had experienced in their hospital wards through video calls and a very thick network of help. We were able to reach them, meeting the people who were victims, those who, the families of those who had died. So very delicate, difficult moments, and everyone actually functioned to give the most of help possible within the shortest time possible. We know that our facilities can be very much organized, but they immediately let us in because we were sharing the same mission. Our goal was never leave anyone alone. This was also connected to the protection factor we could all think of. We could all provide, because getting immediately within short to the places where the pandemic was hitting, contacts with people at home in quarantine, this was our goal because we wanted no one to be alone. Well, you talked about considering the environment and witnesses. I know you have some material, so if you can, please show the other aspect of what you were telling us about interventions within facilities at homes. But let's listen from the real voice of the witnesses what their personal experience, personal perception was. Yes, of course. Yes, I have somehow represented the topics I already discussed about on April 4 during my seminar. We were all like bottled in our own specific reality. Health workers were in their hospitals, some actually somehow self-isolated, even in hospitals, so that they could not be infectious for their families. So this idea, the surreal sensation of not being free to keep contacts. The first thing we tried to do actually was to go against and to fight this lacking contact. EMDR has always been an association that aims at getting to the people as soon as possible, particularly the people who need to tackle an emergency situation. And in fact, Francine Shapiro's goal was to get to the people, because that's very important. People who are broken in their sense of safety, broken by a moment, an unexpected event. So we went to Bergamo in a climate of total uncertainty. It was March the 4th. They were deciding that very day whether we should create the red zone. Do you remember the area of Alzano and Nembro? We went there to meet the local authorities, hence we signed a convention agreement guaranteeing our support. But we didn't know, and they didn't know, what dimensions could have our help. Within very short, what happened? Numbers boomed, and they very consider that all toll-free numbers were all structurally managed by ATS. ATS had to manage numbers of people who were obliged to stay at home, and they didn't know anything. They didn't know anything about how their lockdown would be, how their health would be. There was news on the Atalanta football match. Bergamo had become a hot spot, and hospitals like Papa Giovanni hospitals were totally invaded. A few days had passed, and the ICU actually increased by 10 times the number of its beds. They are very much specialized, hence the fact of finding new beds exponentially. Well, this put the health workers against the very first sense of powerlessness. Only a few individual protection devices we didn't know what IPDs were required. There were no treatment guidelines for the disease. So the EMDR Association thought it was appropriate to start with spreading news, psychoeducation. With ATS, we then created this specific material for health operators, for first rescuers that then traveled all through the region because other ATSs actually required them, providing good practices, behaviors, signals to report, ways to tackle first reactions in this pandemic. We did that for the first rescuers, but also for elderly people, fragile patients who were those who seemed to be mostly impacted by the virus. So to reduce the sense of isolation and also terror and anguish from elderly people, they wondered, what can I do? How can I behave? How can I survive the situation? In addition, again, very quickly, elderlies started to reach hospitals like flows, not in units, flows. So we saw people from the neighborhood disappearing, nursing homes emptied. So we created special material for them, like we created for children and adults. Why is this situation important? Because in such a situation, we as emergency psychologists, as an association, were studying the scenario and we were trying to organize the safest way to perform possible direct interventions. But we could not lose those few hours when important message was to come in. We know that if important message comes to the brain, our brain starts setting up and learning new strategies. Hence, in such a critical situation, it is important to immediately start and activate the brain of the people who must tackle the situation in the most ecological and healthy way possible. We have and here we have the first witness. Then we met Dr. Luca Biffi. Dr. Luca Biffi is a colleague within an ATS. We met him on the phone. Consider that on March the 8th, we actually talked to us on the phone. We met physically in person only in June. So we have managed this all through video calls and contacts that were daily contacts, and we got organized on our support system. I now leave the floor to him in this video to describe what happened from his point of view. The colleague presents us with his experience as regards this first emergency situation that we had to tackle. Federico, can you confirm that the video is starting? Okay, it's coming. Well, good morning, everyone. I'm Biffi from ATS Bergamo. In normal conditions, I work in ITS. I'm a psychologist and psychotherapist, even though after the reform of the health system, I decided I had to choose only for the clinical activity. I am the person who coordinated during the first lockdown the psychological support service from ATS in collaboration with the EMDR Association. What can we say about this collaboration? It was not only a collaboration, it was particularly an enriching situation, not only from the professional point of view, but also from the human point of view. I myself, my service, my operators had no specific experience in the field of emergency psychology And so EMDR supported us a lot, training us basically on how to intervene in these situations. So during the first activity we started, and supporting us with intervention and supervision. So from the point of view of the intervention and from the professional point of view, the collaboration with EMDR allowed us to share the workload. This generated an extremely important collaboration. But I want to stress the fact that this collaboration was also very important from the relational and human point of view. It was a pleasure to meet you. It was a pleasure to work with Stefania Sacchezzin, with whom we immediately established empathy that went beyond professional questions. And I wanted to thank your association, you all, for your support to the one you provided to me, to the service, to the Bergamo area, through the great work you performed. Really, cheers and a hug to all of you. Dr. Biffi somehow summarized what I was talking about before, what worked, particularly the empathic contact, and then the fact that this became a good practice. So what happened in Bergamo, words turned into guidelines. We drew up documents in partnership with Dr. Biffi related to the psychological support that ATS was providing to the population, the operators, the family members of the cases, the people who had experienced deaths, and all the operators from ATS that got sick. So we drew up some guidelines that allowed us to structure a service. This happened within 48 hours. We immediately started with all the names of the index cases, that is, all the people who had had a COVID contact, and we started to make interviews with these people by calling them at home. These interviews were made by EMDR therapists and by colleagues from the health surveillance that we trained for first decompression, as emergency psychology teaches us too. In addition to this, we agreed with the local service psychologists, some will also come in the next speakers, those who were working in hospitals and other situations, to keep a sort of coordination as much as possible, sort of networking that could be consistent. This was very important because as we get into the details of what's happening in the province of Bergamo, what happened, deaths in March were 568% more compared to the deaths in the same month in the years from 2015 to 2019. Health operators then had to undergo greater pressure, and there was no time to wait. We offered support to the population, to the health operators. Quite often when they were working, they had not even the physical and mental time to access support. So they called while they were going back home from work, or while they were at work, and maybe they had moments of break, or they called us and we called them when unfortunately they fell ill. This was to help them tackle the emotional load caused by the pandemic, reducing anxiety and working on peri-traumatic resources. When we talk about Bergamo, 11 internal psychologists, the associations added over 100 EMDR colleagues. We have worked with a group from the Alpine Health, Dr. Sappiotti, who worked on a different area and on different situations. As I said, in this collaboration, coordination organization. Then we also organized a unit with voluntary psychologists who were trained in the same way, so following the same procedure. This meant bringing the same possibility democratically to everyone, to be supported. If we consider the people we helped, we made over 5,700 interventions, both individual and in groups, and we experienced anxiety, concern, anger for operators, anger, frustration, powerlessness, inadequacy. As I said, support to territorial networks. In the very same period with these units, we met 1,900 people, completing 35 psychoeducational meetings in team and supervision, bringing in the contents that were useful to that phase, to manage that phase in the emergency, with the goal to lower the level of activation, lower anxiety and tension, making the people we were meeting more and more feeling the ability to keep control. In the very end, the first support interventions, at the end of this, only a few operators were referred to services to go on with interventions. Actually, people who needed further therapy were those that maybe suffered from deaths that were very heavy. The Bergamo area was actually characterized, unfortunately, by this instability, even in the family connections. And some people in that situation actually needed to be followed in the medium to long term. Hence, here is the second testimony. In the Bergamo area, one of the most impacted municipality was the municipality of Nembro. Thanks to this colleague and to other colleagues on the territory, we were able to create like a specialized cell that devoted only to Nembro, so that we could be even more effective and successful without leaving anyone aside. Stefano will tell us about his experience as regards support to the population, but always consider that these colleagues belonged to those areas, so they experienced directly deaths, disease, and very painful situations. This allowed us to support them because the number of EMDR colleagues I mentioned before means how strong our support was. So here is Stefano's testimony. Good morning, everyone. I'm very happy to tell you about the crisis unit that EMDR has organized in Nembro. This is an experience of emergency psychology carried out from March to June in this very difficult 2020. The characteristic is the immediate synergy between resources present on the territory, the municipal authorities of Nembro, Bergamo ATS, the whole territory, and the Italian EMDR Association. When the service started, the situation in Nembro was dramatic. I'll just give you one figure. Nembro in Val Seriana is one of the centers in the Bergamo area that was mostly impacted by coronavirus. And in the first 21 days of March, we had 1,000% more deaths compared to 2019. From 11 to 121 people died. Within a few days with EMDR Italy, we started a team with 10 psychotherapists from all over Italy, Lombardy, Sicily, Marche region, and other areas. Access to services guaranteed through different channels, a portal on the municipality's website, the dissemination of information through the school IT system, and also billboards at pharmacies, chemists, and doctors, and spreading the word by word on the territory, very capillarily on the territory. I want to remember one phone meeting only, the one with Anna. Anna is a name I invented, of course. A woman aged 45, orphaned with both children, with both parents since she was a child. The husband hit by COVID and in bed. In the last few months, she has lost 4 aunts and uncles. Her history is difficult, but she has great resources. She is a home assistant for elderlies. She says she is not scared for herself, but for her daughter, a newly hired nurse in a nursing home. She cannot go out of her house at the beginning. She feels her legs trembling. Anna lives close to a hospital, so she can hear ambulances going in and there at every hour. She then takes up courage through our phone call. She weans her fears. At the beginning, she goes out just for her cigarettes, then the supermarket. In the end, she resumes her work. In our last phone call, she said it was tough and it's going to be tough, but she adds, I rediscovered in myself and the people around me that we have resources I didn't think we could have. I'll close with a thank you and a quotation. The thank you is for the colleagues in the team I worked with the most diversified approaches, whatever you can think of, systemic, cognitivism, and so on. We have shared fears, reflections, very deep thoughts, and tough experiences. A demanding journey that can transform us. Here is my quotation. You can go millions of kilometers in one life without ever getting into the territories or without ever learning anything from the people you've met. The meaning of the journey is to stop and listen to anyone who has a story to tell. By walking, you learn life, you get to know things, you can heal the injuries from the day before. Walk on, looking at the stars, hearing a voice, following them through your steps. Walk, looking for your life, trying to heal your injuries. Nothing can erase the memory of the walk you've gone through to now. So my thank you and a wish for all of you, never be alone. Good luck, because the journey is still on. Thank you. So here, I think that Stefano was really very effective in presenting how much we were plunged into and connected to the people we met. As I said at the beginning, they were people from the general population, but also mothers, daughters, operators, orphans. Being there with them in those moments meant feeling within us as an emergency network the need to do something, the need to go beyond our own sense of powerlessness, because we were experiencing the same situation. So the experience in Bergamo was very intense. It's still on. Before closing, I'll tell you about the developments in phase 2. But this allowed us to get structured, to network, and to extend this model to the hottest situations that required help. One more much impacted territory in the first phase was the area around Crema. again with very impressive figures, where there was an in-house unit. We had already worked with them for another emergency of a bus that had been kidnapped 1 year before. So the psychology unit organized a crisis unit that was trained and supervised by the EMDR Association to provide support inside the hospital for health operators and workers. The COVID units that had constant contacts with the COVID patients, considering whatever was needed, like managing the families from far away and support during the moment of death. This allowed the unit to actually gain experience within the situations. A helpline was set up to require remote support, and the psychological clinical unit turned into an emergency unit where training was provided to the health operators who were working, so they could actually access training whenever they wanted to start and provide how to manage communication with the family members, how to contact psychologists, how to use the most appropriate situations to manage such a traumatizing context. We provided good practices for the phone calls. We drew up guidelines and protocols, offering also some decompression channels for those hospital wards that were mostly impacted. Of course, the work has been on since March, and it is still now on. The colleagues who have helped were colleagues who were already in the hospital area, so they could access easily to both the relatives of COVID victims and to the same COVID patients. And they could work in presence with the operators. Now the word to Cinzia Sacchelli, the director of the Crema unit, if I can actually launch the video. Here we are. She's telling us about the experience on the Crema territory. Sorry, I cannot find the video. Oh, there we are. It's coming. Just a second before it starts. Okay, there it goes. I'm Cinzia Sacchelli. I'm in charge of psychotherapy services at the ASTT in Crema. What we have experienced in the first wave here cannot be described. You cannot even imagine that. In just one day, we had to stop all activities. Nothing was safe. We decided to set up the emergency psychology team to actually gain forces, to understand what was happening, what we could do for the situation that was on. All psychologists participated in this experience. We got a call from Stefania Sacchezzini and Isabel Fernandez. They were helping their availability to work with us. Hence, we set up also an agreement that envisaged training by EMDR and the supervision of the emergency psychology team. So within short, we actually started to meet through a smartphone or a PC. We actually settled meetings just to share what was meaningful to do, what we could do in those situations. The first interventions were psychoeducational interventions for the colleagues and the population, hence articles that allowed to have indications and to feel that someone could give orientation in such a terrible situation. Then the activation of the hotlines for the population, for school boys and girls, operators, families, teachers, people who actually had to work with Alzheimer's patients and disabled people. With the colleagues, we started making ourselves available personally by providing a very general offer. Just call us, then we'll see what we can do, because it was very difficult to think about something structured at the beginning. The thing later got organized through a very good network, through the general practitioners who sent in colleagues who were suffering, also colleagues who for the first time were not those who provided help, but they were those who needed help. And after then, also the people who were hit by COVID and who had to go back to work after it. So we have offered the possibility to access our services spontaneously through some agreements with the head doctors in the ICU units. We were able to organize debriefing groups with our own colleagues. Through the general direction, we have started self-assessment work for all the colleagues by administering them questionnaires, self-assessment questionnaires related to their own emotional situation, the IES and the GHQ. And 70 actually returned the results of this self-assessment, thus allowing us to confirm that about half the colleagues who were working in hospitals in very different situations compared to the ordinary ones were suffering from a form of PTSD, which we later treated with the modalities our colleagues allowed and requested, depending, of course, on the situation of the moment. As a matter of fact, we have always worked with colleagues from the territory to help them take up unusual roles compared to with what they were used to. We needed someone to work with the people at their homes. So also physiotherapists, administrative professionals, they all had to call people at their homes to monitor their conditions from remote, to provide information, indications, and bad news, unfortunately. What we have done in our team was help them, train them, offering advice and supervision with possibility to refer them, the people to us, and the availability to take them up with their conditions that were really traumatic. This actually envisaged not only individual but family tragedies, because when a person died, there were other people who were quarantined or hospitalized without even the possibility to know where the people were hospitalized. So this is what the people experienced in the first phase. All this work with the territory actually changed into something more stable later. Psychology has now become a component of the territorial offer through the collaborations we have built. And little by little, the organization developed, providing remote possibility for treating, including the psychological support, which is now dealing with the work with the patients from the first wave, of course, who are experiencing PTSD, and particularly related to their hospitalizations for months, and also the second wave clients with a more generalized screening on a neuropsychological assessment, because research is telling us that, as a matter of fact, several hospitalized patients have sequelae in terms of cognitive functioning. And this allows us to provide more targeted interventions for the people who are in conditions of higher activation and stress. So this is what we have built little by little. Today we have a territorial psychology unit. We have a team that works on work-related stress that has become a reference point within the hospital. We've come here. We are coping with the second wave. In Crema, we are also experiencing the second wave, but for sure we are more organized now. We are better equipped. We know we can better respond to the needs that our citizens and our colleagues are bringing forth. So, to close these two experiences in Bergamo and Crema, from the colleagues' words, you have heard what worked well. What was a target for us, which we have tried to reach. Beside getting and approaching all the people who were involved as patients, as operators, as families, as relatives who had lost someone to the disease within the shortest time possible, we revolutionized the in-house psychological units, thanks to the constant collaboration with the unit heads that had already a very strong ground to work on, made of trust with the team leaders, the different head doctors from the different hospital wards and clinical units. Let's think about Dr. Biffi, for instance. He already had territorial links that were very strong. For instance, in schools, corporations, general practitioners, we were really able to establish a new service by revolutionizing an old one, providing EMDR support through the colleagues that made available passionately through video calls or accessing the families in their houses or in the hospital, starting to work immediately on the peri-traumatic component with the use of specific protocols that for sure brought some relief. It was a major work that in the first phase, as Cinzia said, brought some sort of awareness, the presence of major skills that grounded resilience since the very beginning. This is shown in the second wave. The colleagues who were mostly hit in the first wave and structured a number of protocols and projects. In the second wave, they are responding always very effectively, without leaving the sense of absurdity and irreality that was experienced in March instead. This is very important regarding what we said at the beginning, because if we must support a person or a doctor must support the patients, it is important that these people can find a person to support them within their own window of tolerance from the stress point of view, thus managing productively their own reactions. And to do that, they must feel safe. Another experiencing I'm bringing in, and I'll be very quick. Why am I bringing it among many others? Because it's a connection point between phase 1 and 2. The one from the territory of Belluno in phase 1, quite saved compared to Bergamo and Brescia. In phase phase 2. Instead, they are very tormented by the presence of more hospitalizations, so more health emergency. The colleagues in phase 1 actually got structured thanks to the collaboration with us. They organized intervention areas that are those we have already seen in the area of Bergamo and Crema. They started setting up support for operators, for COVID patients, for family members who had lost someone to the disease. They started implementing the model that was coming up. So training pills, groups with doctors. It was possible to do that here in the first phase because that was calmer in the first wave compared to Bergamo and Crema areas. So they set up this very modality. And what happened? It happened that this has made it easier in the second wave to go through some steps that have become automatic steps. Health workers know there are teams. They know they can talk to psychologists. Groups have restarted. So we are offering constant decompression to the same health operators on the field, both at territorial and hospital levels. And hence we are developing a model more and more. In this moment, we are talking about COVID emergency in hospitals, and we are creating guidelines to allow families to connect with hospitalized patients. The hot spots, ER and ICU, are organizing these very paths, bypassing somehow the critical factor in grief that was the inability to see the person who was dying, the impossibility to be there during the moment of death. So what families only had was the words and a few video calls they could have with the doctors. Now, this part, however, is being structured very well. A basic message is the one we had in the first what we did in the first wave was not lost and not underestimated. We could actually set up a very strong network, and that is why we are coping with the second wave. Now, a closer reality for us, it's the reality in Milan. Here, we have worked since March as regards phase 1. What did we do? As in other cases, we have trained all the colleagues inside the different local health units on the main decompression tools. Then we helped the people who were domiciled at a COVID hotel, the first COVID hotel born on the Lombardy territory, the Michelangelo Hotel, where they were supported, particularly the people who had to be quarantined in this hotel. This allowed us to have a screening on the whole population inside the Michelangelo Hotel, thanks to the presence of EMDR therapists. We made psychological interviews on both patients and operators. We had 12 EMDR colleagues who worked with the psychologists from the team. We provided to 30 people, about 15 colleagues to 15 operators, about 60 interviews. This was the experience in Milan, which is actually developing and which is still active in phase 2, thanks to the same modalities, but in more accurate and specific way as regards COVID hotels, which are more in this second wave. What's the food for thought here? The take-home message, the possibility not to leave these people who had to experience their quarantine. They had no disease from the point of view of symptoms. They had no serious symptoms from the disease at the time, but they felt the anguish they had to experience their disease in a hotel room. Yes, they were taken for, they were taken care by the people who were tackling all the practical problems, but they were quarantined, totally isolated. So a sort of imprisonment far away from the own home, the own family. The specificity of this support by our colleagues was the great flexibility, because they actually could access different cultures and languages. Many patients were not Italian, not speaking Italian language, so we quite often had to use a connection with major reference points like cultural mediators, and this allowed us to develop specific support systems for these patients. This gave us the lesson that when there's a need, nothing is impossible. The creativity in our interventions is a situation that allows, within short, to have very effective solutions that can become models for intervention. Now, a territory which is quite close to me, this is the area that was mostly impacted at hospital level in phase 2. We were impacted the most in Varese. We have worked with the ATS in Subria, same way we actually provided for the other ATS units. We have worked with the Varese hospital. And in this second phase, the Varese hospital was totally invaded. It was transformed within a few days from a hospital with many wards to mainly COVID hospital, reorganizing structures, doctors, equipment, wards, and so on. I'm giving you this example because that came from phase 1. Dr. Bellani and Dr. Trotti actually asked us to train the colleagues from the SST under the same modalities as the others. And in July and August, right because the first wave had gone, they allowed us to enter the wards and to start work with the operators. This was a major step, a winning step from the point of view of psychological relief, because getting in there meant meeting them and allowing through the EMDR groups to let the load of phase 1 go. Just think about the figures from after half of September. Patients started to grow in numbers, so they were in a terrible situation within a few days. So it was very important to be there in that phase to remove as much as possible the stress they had experienced in March. After Varese, I'll also talk about Asti, where we were quite late, but to show more the aspects connected to post-traumatic stress, how perception changes when we can remove, for instance, the accumulated stress after the first wave. Operators and people then feel readier to be within their own window of tolerance. With the figures we had, less irritability, fewer depression sensations, and less reactivity in the operators we were able to meet between phase 1 and phase 2. I now leave the floor to Aurelio. Aurelio is the person in charge of the whole training parts of the Varese hospital. He is a nurse demobilized onto the COVID area in phase 2. He's one of the people who actually benefited from the support. Okay, in this step, this is always very difficult. Good morning, everyone. I'm Aurelio. I'm a nurse. As many health operators, I was impacted by the first pandemic wave, and I'm still like that. In the first phase, emergency prevailed. The need, as now, was to be there independently on the number of hours and the quantity of people to support. Being there meant being in definitely new situations under different points of view. Supports models connected to isolation, to communication that had to be restructured to go beyond the barriers, the physical barriers. Not only communication had changed between operators and patients, but also between the operators and between operators and families. With them, communication was almost always through phone. That was also the only communication method to our own families. We felt this strongly after the first wave, and the certainty of the second wave didn't allow me to remove the past experience, irritability, low concentration. Hence, I decided to take advantage of the possibility I was offered to go through an EMDR path, thanks to the Italian EMDR Association and Stefania Sacchezzin, with the possibility to recover mental energies. After a few meetings, I started feeling the benefits. I kept the memories useful to go through the second wave, but reducing aggressiveness and irritability that were eroding my energies. Now I can cope with the second wave with more awareness and concentration. So words follow the figures I'll show on Varese, what we have done in terms of support and training. We are envisaging support assistance through a project for 2021 to foster self-regulation and emotions monitoring, stress monitoring, resilience, well-being in complex situations as this emergency was. We had 30 groups of operators reaching 85 people, 15 accesses to individual therapy for about 28 interviews. 30 EMDR colleagues worked in July and August, working again here with the clinical hospital psychology unit mates who could not take everyone up because they had to go on with their ward activities and with their own patients. We are talking here about colleagues who were also involved in oncological situations, ICU situations, so they could have never borne the whole load of the COVID-related needs as regards psychological support. The very same colleagues actually supported the population, also through the service that was offered by ATS in Subria, which dedicated special training to the new general practitioners, of course, to approach doctors on the territory. The new general practitioners were put in contact with such an adverse situation like the COVID and the COVID patients ones. So we also thought they had to be supported, providing them support. We are in phase 2 here. Realities here are always the same. In the territories that were little impacted by the first phase in terms of deaths and exponential growth in hospitalizations, so they got organized so much that in phase 2, they are really devising medium to long-term projects. I now leave the floor to Oscar. Oscar Miotti is a colleague we've worked with quite often during emergency situations. He is the person who, with other colleagues like Cristiana, with the Veneto area, he is telling us about the Veneto experience and the experiences, considering that Veneto is one of the areas with the highest figures. What are the operational hints for phase 2? Good morning, I'm Oscar Miotti, psychologist from Veneto region. I want to share my experience. In March 2020, together with a colleague, Cristiana De Luca, we activated to realize a service for free psychological support to the benefit of the Veneto population involved in the COVID-19 pandemic. Our partners were the EMDR Italy Association and Sani Veneto, a fund. Within short, we completed hundreds of interviews, and in the end, we also helped the Bergamo colleagues who were involved in a very tough emergency. Now we are ready to replicate this project, and in addition to this, we are completing a project with the local health system in Veneto, where we are assisting the operators working with COVID patients. I want to thank the EMDR Italy Association and Isabel Fernandez, particularly with Stefania Sachezzin. Thank you for your help. So being present, being there means this. It means opening up the doors to newly originated needs we could never envisage in phase one. We would never think what hospitals, regions, and territories would be mostly impacted by the second pandemic wave. And hence, it was very positive to create models, consistent models, also meeting professionals who were already working on mental health within the institutions, the territory, and the hospitals, thus bringing contribution in terms of resources to relieve such tough numbers and to structure protocols and operating modalities that could be then specifically targeted and reprocessed to accompany the very same emergency steps. If we consider this second wave in the end, what's the lessons we have learned? What are the data we have collected on Varese? Varese is one of the most impacted area in phase two, and we see here how the intervention with IES and T0s, that is when we got there at the end of July, before creating the groups, 26.3% of the operators showing a clear PTSD symptomatology, with the presence in the different underscales of avoidance, intrusivity, hyperarousal, 4 avoidance, 3 intrusiveness, 5 hyperarousal. What happened after the group EMDR intervention? And those who followed the individual path, the percentage of people showing PTSD symptoms dropped 9% only, and also the scales represent how the presence of avoidance, intrusiveness, and hyperarousal have dropped considerably. For us, it was paramount, for the colleagues working in Varese and on the territory, it was very paramount to do this, because this allowed us to access, to have contacts in a period when, as Aurelio was saying, we started feeling tired for phase one, and we were aware that phase two was about to start. We are probably now having another step to go through, but we are convinced that what we have generated to now has generated, as you heard from the people's words, a virtuous cycle in the ability to be able to recognize, to ask for help, and to obtain the possibility to be at the center as people, thus stripping off those sensations that those tough months when we were like robots, to be alive again. What I was mostly impressed by, of all the sensations I still have as regards the sanitary health part and the pain that we do have to tackle, so what I still have is this deprivation of personal identity. women rescuers, women officers that spend hours and days in their overalls, well, they are still now carrying this sensation that they feel dirty. They cannot actually touch their children, their husbands. This sensation that they are dirty, this sensation of contamination, particularly in the units that work outside hospitals with COVID patients. So I'm talking about the emergency line operators who enter the houses. The houses are places where everything is considered contaminated, so they do not feel safe. In this phase, we are actually working with them. We are setting up this support on the whole Veneto area, also intensifying EMDR on the extra hospital rescuers, right? Because there are major effects on this. The last thing before concluding is, well, I'll just leave you some food for thought, also connected to what is coming after us, the area of Asti. We started with them in mid-September. We were able to get organized with Dr. Marenko at the time. Of course, he strongly contributed and made available the colleagues whom we have worked with. They stopped at T0 because we had seen them already before, when phase 2 was already showing up. And I have brought here, because have a look at the figures. 50% of operators refer suffering, even higher than in Varese. What happens? The presence in the subscales is much higher in terms of intrusiveness, hyperarousal, avoidance. They are much higher compared to what we've seen before, and this confirms the need to continue this path now that the situation is getting normalized, to reproduce the same effect we've already had in the other realities which we have witnessed from the point of view of the health operators, the caregivers, the families, the patients. All realities were tested through a screening before and after treatment, so that we would never lose focus, and always do better and better to produce an effective intervention for the people we are meeting. For me, this was an occasion for professional growth. This was an occasion for personal growth as well. As usual, when you work in an emergency setting, after me, Dr. Maslovaric is speaking, and I had the honor to actually share many of these experiences with her. As usually, I take home the fact that being part of EMDR is like being on a safe ship, on a safe vessel. Even when the sea is rough, we can be very well organized. We can give everyone the possibility to feel safe. So we are doing something very important. I'm also taking in the smiles, the pains, and the cries I've experienced, both those from the colleagues, psychologists, psychotherapists who've fallen to the disease. As Stefano was saying, many of us have lost someone. We have all come in contact with death and grief. And also the health officers whom I met in a condition of disease, so they perfectly knew the anguish that they and I could feel. Then this all changed and we could get to well-being and back to normality. That's why I'm actually greeting you with one of the writings that I received from a mother, a doctor treated after vicarious traumatization and her own experience. This mother writes, I dreamt one night that everything that had happened could disappear like in a bubble. I dreamt that the world could be back to smiles, caresses, and hugs. I dreamt a lot in that period, but quite often I understood that little was worth dreaming when in the morning, when I opened my eyes, everything was there. That's why I started using my eyes to observe around me. I noticed how much they had cried and they were tired. I decided to use them in the end as a mirror for my soul, letting life go on and off. It was as if they got safer and calmer. It was me in my life, not as before, but it was me. With the deaths I had seen, now I could actually feel alive again. I do not regret anything that has happened. I know I did the best I could. They know they did the best they could with all the courage they could find. For me, this is a representation of the drawing I had used last April, a person actually outside of her own container, looking outside of the window without gazing only at the barrier separating her from the world. So I want to thank you for your attention, and I leave the floor now to Federico, but I also want to thank the association and Isabel Fernandez, because we have made available the possibility of being together in a moment of anguish. Thank you, Stefania. Really, a breathless run through different territories, through the recent past, even though that seems so far away for the many things and sensations and emotions that we have experienced. You've given us numbers, testimonies, but I also took notes of some key words you were saying, from codifying best practices that seem to be like the starting point for our work, training, resilience that have to go hand in hand. But I was also impacted, and I would ask you to answer in 30 seconds by the expression you used talking about the COVID hotel in Milan, but I think that's a concept you can expand. Creativity during the intervention. Why do we need creativity in our interventions, and we cannot just follow predefined policies that can always be replicated? Well, because the scenario is master. This is how it works in Maxi emergencies. So I'm not an expert. I might even say something which is not precise. It would be better to ask this question to more technical people. But I've grown in those scenarios, and the scenario is master. So you cannot think as a coordinator or as an operator. You cannot believe that you must not learn from the scenario you are experiencing. There are protocols that allow you to be effective and successful, but there's always a part which, as EMDR says, you need to have a double focus, one foot in the experience, one foot out of the experience, that allows me to reorganize, as in this case, we reorganized the support modalities, we reorganized how to access to clients, guaranteeing our operators could be safe. We have organized the timing for the meetings, the moments, the groups. We have reorganized everything we could have never thought about reorganizing if we had only based ourselves on the experience on the different seismic territories or the collapse of the Morandi Bridge. So when you actually start working in these situations, you must have some building blocks, which are our own guidelines. You must, however, be able to dance following the music. That's why I'm talking about creativity. And I want to thank Stefania Sacchezzin because she also shared all her experience, her ability to dance following the music. Thank you for this overview. The figures you have shown are a lot. They must be digested and reflected upon. Someone used to say, improvise, adapt, get to the goal. These are the rules of the emergency. But we want to go on safely, and that is why we are asking you to take a coffee, take a breath after all these figures. We are back here at 10:45 with Dr. Jada Maslovaric, who will actually go on this journey with us. So see you in 15 minutes back here. Thank you.